things we talk about with outcomes. So complication is going to be something that's a complication from another disease, basically. Pretty self-explanatory. So somebody may have diabetes, that's a chronic condition, and then they may have a complication because they're having major kidney problems, maybe kidney stones. So the kidney stones would be a complication of the diabetes, or maybe even kidney failure. Then we have a sequela. This is the aftermath of a disease, just like in movies when they have a sequel. It's the last one, or the last of a movie. And so this is considered a sequela, is the aftermath of a disease. And the book gives you, or the PowerPoint gives you an example of polio, even though we don't see that commonly anymore. A permanent sequela of that is paralysis. Let's say trying to think. Okay, let's take shingles for an example. Shingles, you have pretty bad nerve pain and a rash that goes along with it. The rash may go away, the virus may go away, the nerve pain may be there the rest of your life, several weeks after, several months, or even several years after. Shingles is already gone. So that's another example. Then mortality and morbidity. These two are commonly confused. Mortality is a measure of death attributed to disease. So that would be like one of the first couple of slides we looked at, like heart disease. There's so many thousands of people, hundreds of thousands of people in the U.S. that have died from heart disease. So that's considered the mortality rate. Then we have morbidity, which is a measure of disability that a disease causes. Okay, so mortality ends in death. Morbidity is a measure of disability. Alright, going on to the next page, we talk about etiology. Etiology is the cause of a disease. We have to know what causes a disease. That's part of medicine, is having to know. We can have, sometimes we just don't know, or we may have guesses of what could be causing. But when we don't know what a disease is, it's considered to be idiopathic. And idiopathic means no known cause. Then, I don't believe this is in your PowerPoint or your book, but you also have an etiology that is called iatrogenic, and that's IATROGENIC, iatrogenic, and that means that it's calls from a hospital, like if you get MRSA from the hospital, that's considered an iatrogenic cause. And it doesn't necessarily have to be from a hospital. It could be acquired from any type of medical treatment or anything that's happened medically. So again, etiology is the cause of disease, and that gives us the pathogenesis. Is basically, we want to know pathogenesis. Think of Genesis means beginning, like the first book of the Bible. So we want to know, how the disease is from beginning to the end. We want to know the complications. If there's sequela, we want to know the morbidity and the mortality rate. And then look at the right side of that. It says microbes, genetics, and environment leads to, and then we have inflammation and lesion. So all of these connect and form your etiology, which is the cause of the disease. So we need to figure out, is it due from inflammation? Is it caused from infection, etc., etc.? The next slide, again, is another video on immunity, so make sure you look at that. Then we go on to slide 22, which is risk factors. A risk factor is something that you have that puts you more at risk for a certain condition. So it predisposes you, and this is also, instead of risk factors, it may be called a predisposing factor. So a risk factor is not equivalent to a cause. That doesn't mean that what your risk factor is causing you to have this. It means that favors are present that could cause you to get the disease, but you don't have it now. So risk factors could be environmental, You know, if you smoke, that's a risk factor for heart disease. Hold on one second.
Passing on to everybody. 6 o'clock, we shut the building down.
6 o'clock? Okay.
Yeah. They've got this schedule that Bob put out all week long. 6
Okay.
o'clock all week.
Well, I'm fixing to be down here in just a second.
Okay.
Just record
I just didn't know if you knew. I mean,
No, I didn't.
they put an email out.
Did they? We probably
6 to 6 schedule. 7 to 6 is what I think they have on the schedule. But
Okay.
security's here 6 to 6.
Okay. Sounds good then. Thanks.
Thank you.
Sorry about that. Okay, anyway, so a risk factor is something that predisposes you to a certain condition. It can be environmental, it can be chemical, it can be physiological, psychological, or genetic. So let's look at environmental. Again, if you smoke, a smoke is a risk factor. Smoking is a risk factor for heart disease, a risk factor for cancer, etc., etc. Chemical, if you're exposed to asbestos, that can give you a predisposition for cancer. Physiological, psychological, genetic, and the list goes on and on and on. So that is what a risk factor is. And then the last slide, I believe, is treatment of disease. And treatment, of course, is whatever we're using to make the disease better or make it go away. But this includes medicines, it may be procedures, anything for to cure the disease or at least reduce the symptoms of the disease. It depends on the nature of the disease, the characteristic of the patient, and the goals of the patient and the physician as to what type of treatment they're going to do. For a patient that has end-stage cancer, you could probably do chemotherapy, but chances are they're probably going to pass away anyway with most cancers. So some, physicians and patients decide not to do chemotherapy so the patient is not very sick during the last few weeks to months of their lives. And again, not all diseases are curable, so sometimes we have to, just treat the symptoms. And when we treat the symptoms only of a disease, that's called palliative. Palliative. So that's when we can only do palliative treatment, which means treating the symptoms. Alright, that is the lecture for Chapter 1.